So today we're going to talk about Huntington's disease. So Huntington's is caused by a mutation in the Huntington gene, also known as the HTT gene. Now normally this gene has a repeating CAG nucleotide um, or a set of nucleotides, and those repeats are usually less than 40 in a normal person. But with someone with the disease, the CAG has repeated 40 or more times. And basically this causes the gene to code for abnormal HTT protein. So the protein is misfolded and it can cause neurotoxic effects, and it can just progressively damage brain tissue. And a lot of this damage occurs in the basal ganglia of the brain, and part of the basal ganglia is what's called the striatum, which works to inhibit the unwanted motor control. So when you have progressive damage of the striatum, it causes what's called Huntington's chorea, which is this kind of like twitchy, dance-like symptom of the disease, or sign of the disease. Now everyone has two copies of the HTT gene, but only one mutated copy is enough to pass it on to the offspring. So children of an infected parent have about 50% chance of inheriting the disease from that parent. And the onset and the progression of Huntington's is actually determined excuse me, determined by the number of repeats of CAG. So the longer or the more repeats an affected individual has, the earlier the age of onset and the faster the progression. So someone with 55 repeats is going to generally be hit at an earlier age and a faster progression than, say, someone with 45 repeats. And also, on top of this, the higher the number of repeats someone has, also increases the likelihood of mutation during DNA replication. And basically what that means is when a parent, say a non-Huntington's parent, 35 repeats or so, has a child, it's possible for that HTT gene to have mutated to produce, let's say, 45 or so, or 40 repeats of the CAG. And this actually causes Huntington's in the child. And then on top of this, over generations, from, say, grandparent to parent to child, grandson, whatever, the repeats can increase over those generations and actually cause increasingly earlier age of onset and a faster progression within those offspring. Now, because of where Huntington's affects the brain, there's a plethora of signs and symptoms that go along with this disease. Of course, you have the Huntington's chorea, which is the involuntary movements associated with the disease. But along with that, you'd have a lot of physical symptoms you'd expect with involuntary movement. You have abnormal gait, you have problems with coordination, atrophy of the muscles, muscle spasms. You can actually have weight loss from this, from the tremors and everything. But you also get psych symptoms that accompany these physical symptoms, and oftentimes these psych symptoms will actually hit the patient before the physical symptoms, and these can actually be pretty big as well. Anxiety, depression is one of the bigger ones. That's depression is actually, or suicide specifically, is the second leading cause of death in someone with Huntington's. But you can get mood swings, delirium, memory loss, confusion, hallucinations, and then as well as you can actually have impaired speech. And these are just some of the signs and symptoms that you can get with this disease.
When it comes to lab and diagnostic testing, there are not many labs that can confirm whether or not a person has Huntington's disease, but there are a few diagnostic tests that can be performed. First off is a preliminary diagnosis. This is when the doctor may ask a series of questions, conduct a physical exam, and review family medical history. When this is complete, the doctor may feel the need to do further testing to confirm the diagnosis. Next is the neurological exam. During this exam, the doctor will test the motor symptoms such as reflexes, muscle strength, muscle tone, coordination, and balance. The doctor will also test sensory symptoms such as sense of touch, vision and eye movement, and hearing. Finally, the doctor will assess the patient's mood and mental status. The neuropsychological testing is when the doctor performs tests to assess the patient's memory, reasoning, mental ability, language function, and spatial reasoning. A patient suspected of Huntington's disease may be referred to a psychiatrist for an exam to assess emotional state, patterns of behavior, quality of judgment, coping skills, and signs of disordered thinking. The doctor may order that the patient have a CT or MRI to assess the structure or function of the brain. These tests may reveal structural changes at particular sites in the brain affected by Huntington's disease. The test that is used to actually confirm the diagnosis of Huntington's disease is genetic testing. Using a blood sample, the genetic test analyzes DNA for the HD mutation by counting the number of CAG repeats in the Huntington gene. For someone that has a family history but shows no signs and symptoms of Huntington's, they can choose to do predictive genetic testing. This testing does not indicate when the disease onset will begin or what symptoms are likely to appear first. Someone may decide to do the predictive testing if they think that it's stressful not knowing, and if maybe they want to have children in the future so they know if there's a possibility that it can be passed on.
Due to the involuntary facial movements, the patient with Huntington's disease may experience difficulty swallowing or swallowing problems that could lead to aspiration. Aspiration is the first complication of Huntington's disease. This is when the food particles enter into the wrong pipe or the trachea instead of the esophagus. So the food goes to the lungs, and the lungs get infected and cause serious health problems such as aspiration pneumonia. Aspiration pneumonia is the number one cause of death per patient with Huntington's disease. Aside from the difficulty swallowing, the involuntary facial movements for the patient with Huntington's disease may also lead to the difficulty chewing. When that happens, the patient with Huntington's disease, cannot get all the vitamins and the minerals from the food that they eat. So it leads to malnutrition. As you can see here. Um, Malnutrition is the second complication of Huntington's disease. Due to the involuntary movements of the patient's arms and legs, the patients with Huntington's disease may develop gait abnormality. Gait abnormality makes ambulation impossible or difficult.
Next up is nursing interventions. A patient with Huntington's disease and the caregiver will need some nutritional teaching. Most patients with Huntington's disease require 4,000 to 5,000 calories a day to maintain their body weight because of the choreic movements that increase caloric requirements. As the disease progresses, the patient may have difficulty swallowing and using utensils. The nurse or caregiver may need to assist with feeding and consider an alternative feeding method. The nurse will also need to discuss end-of-life decisions with the patient and caregiver. Things to be discussed include living arrangements such as in-home care or nursing home. Advanced directives and guardianship should also be discussed. As the disease progresses, the patient may be unable to make their own decisions and will need someone to make those decisions for them. We also need to ensure patient and caregiver safety at all times. For example, the patient may become aggressive and require some type of restraint to keep both the patient and others safe. One of the main interventions is to keep the patient comfortable. This includes regular bathing, skincare, administration of meds, etc. The nurse and caregiver should also focus on keeping the environment calm and avoiding stressors. This includes having a regular and consistent schedule and breaking down tasks into manageable steps. The nurse should also inform the patient and caregiver of available support services. These include support groups for both the patient and caregivers. Also, there is the opportunity for daytime care.
Now I'm going to talk about some of the nursing diagnoses for the patient with Huntington's disease. The first nursing diagnosis is the rest for aspiration. This is related to the swallowing problem. So what the nurse can do is to keep the suction equipment at the bedside. The nurse can elevate the head of the bed, turn the patient, inside lying position, and most especially give the patient the time to chew or to swallow their food. The next nursing diagnosis is the risk for falls. This is due to the gait abnormality. So the nurse can provide fall precaution or the yellow bracelet. The nurse should answer the call light immediately. The nurse can provide a bedside commode and always um, lower the bed or put the bed in the lowest position before leaving the patient's room. The third nursing diagnosis is the risk for suicide. Psychiatric problems are the first manifestations for the patients with Huntington's disease. So, as the disease progresses, the patient suffers anxiety, stress, and depression. So these symptoms lead to the increased risk of suicide. So the nurse can encourage the patient to express their feelings. Family support is very important, and also providing a safe environment for the patient. The next nursing diagnosis for the patient with Huntington's disease is the balanced nutrition, less than body requirements. This is due to the decreased ability to ingest the food. So what the nurse can do is to collaborate with a dietitian for the patient to have an appetizing food, give the patient small frequent meals rather than large meals, and or provide oral hygiene. This is to prevent mouth dryness and to prevent the possible infection. The last nursing diagnosis that I'm going to talk about is the impaired verbal communication. This is due to the facial involuntary movements. So the nurse should pay attention to the nonverbal cues. The nurse can provide whiteboards, tablets, flashcards, and most especially, the nurse should give the patient the time to respond. So then be patient and do not be in a hurry.